Why is bioequivalence so important for generic drugs? Bioequivalence is a quality that demonstrates that two drugs are equivalent in quality, safety, and efficacy, and makes it possible for two drugs to be interchangeable. Let's look at it in detail and understand it better. First, to ensure that a drug is effective, it must reach to the point where the drug intended action can be exercised. While there are pharmaceutical formulations that act locally, such as creams on the skin or local anesthetic at the dentist, normally the drug has to reach the site of action and be distributed through the bloodstream. In the case of oral solid dosage forms, as a tablet and a capsule, they first have to pass along the mouth, pharynx, esophagus, and reach the stomach where they normally begin to dissolve and release. Then, it will reach the intestine where it must go through some layers to absorb and finally gaining access to blood. However, it's not so simple to predict the accuracy in which this process will happen. Normally, it depends on the physiochemical characteristics of the drug, of its formulation and administration route. Also, it will depend on every patient case and many other variables. And how can we ensure that the drug will reach the bloodstream in the correct time and quantity and that it will be effective? For that, we have different methods. Among them, we have the bioequivalence studies. In oral solid dosage forms, although there are exceptions, we conducted bioequivalence studies in healthy volunteers. Now, we can compare the drug plasma concentration of each medication in the volunteers. The results are represented with a graph. On one axis, we will have the plasma drug concentration and on the other one, the time. Normally, a curve is formed, which reflects the behavior of a drug that increases absorption until it reaches a peak, and then decreasing concentration as it metabolizes or eliminates. The peak concentration is the maximum plasma concentration, known as Cmax, and occurs at a specific time, known as Tmax. Another important parameter is the area under the curve, or ABC, which corresponds to the total amount of active principle absorbed. As we mentioned before, it is important that the absorption takes time in an appropriate time and quantity. If the generic drug would be absorbed faster or slower, but it would take longer to be eliminated, we will have a higher peak or higher drug exposure, and that, in the end, may affect toxicity, adverse effects, and safety. Afterwards, these data are statistically analyzed to demonstrate that are enough similar. As we can see from the graph, these are practically the same, and it reaches the bloodstream at the same speed and amount. In this case, we can say that they are bioequivalent. They are similar in efficacy and safety, and therefore interchangeable. For this reason, it is critical to require that a drug should be bioequivalent. They assure effectiveness and safety of the drugs, which are key concerns and directly affects our patients' health. Another essential aspect of medicines is their quality. We manufacture according to the Good Manufacturing Practices, GMPs, and quality control during the whole process. GMPs are guidelines or standards applied in a manufacturing process to guarantee the highest standards of efficacy, quality, and safety. GMPs are mandatory for all medicines in the European Union. In quality control, we inspect 100% of our raw materials and finished products. We use advanced analytical techniques to ensure the product's highest quality and safety. At Normon, we were pioneers more than 25 years ago, launching the first generic drug and conducting the first bioequivalence study in Spain. If you have any doubts, please ask to your Normon sales representative. Or if you want to know more about our company, visit our website. Thank you very much.